Hello, and thank you for your interest in learning more about Virginia's Project Pipeline. Project Pipeline is a performance-based planning program to identify cost-effective solutions to Virginia's multimodal transportation needs and priorities. The program was created by the Commonwealth Transportation Board and is led by the Office of Intermodal Planning and Investment, the Virginia Department of Transportation, and the Department of Rail and Public Transportation. Project Pipeline is intended to provide a clear connection between the Commonwealth Transportation Board's VTrans priorities and Virginia's project development and prioritization processes. It aims to implement a statewide look at needs and formalize the connection with planning, funding, and programming transportation solutions for Virginia. The objective is to focus on the priority locations and corridors that were adopted during the VTrans process, which was a comprehensive assessment of transportation needs and long-term risks as well as opportunities to guide Virginia's transportation future. The goal is to develop projects, solutions, and investment strategies that may be considered for implementation through funding programs such as Smart Scale, revenue sharing, and interstate funding, as well as local, regional, and federal funding sources. If we streamline the project planning and development process, we can improve project readiness and better manage project risks. To accomplish these goals, we are improving the tools to leverage various data sources and improve our collaboration with local governments to better understand the problems facing the transportation system. Project Pipeline is modeled after and builds on the success of the Strategically Targeted Affordable Roadway Solutions Program, often referred to as STARS. This program has been one that the Virginia Department of Transportation has administered since 2007. Approximately 80% of the recommendations from the STARS program that have been submitted for Smart Scale have been successfully funded. As noted previously, the focus is on priority locations that were adopted by the Commonwealth Transportation Board during the development of the VTrans Multimodal Transportation Plan. The priorities involve various need categories such as safety, accessibility, reliability, and congestion. There is frequently an overlap and intensity of multiple needs occurring in the same location. Medical staff will triage patients and focus on a patient presenting the most severe needs. Similarly, the Project Pipeline program focuses on developing solutions for the transportation facilities in each region that present the most critical needs. Virginia's Smart Scale process is about selecting the right transportation projects for funding and ensuring the best use of limited tax dollars. This process has resulted in a paradigm shift. Prior to Smart Scale, projects would often be selected and programmed before the preliminary engineering and design process determined the actual project details and scope of improvements. As a result of Smart Scale, the planning and scoping needs have to occur first in order to calculate and evaluate the benefits of the proposed improvements, and then to develop reasonable cost estimates prior to selection. Once selected, projects are fully funded in the Virginia Department of Transportation 6-year improvement program, which minimizes risk and ensures timely project delivery. What does performance-based planning look like? Let's look at an example. If you were to get in your car and start the engine and the check engine light were to come on, would you immediately assume that you need to replace the engine or buy a new car? In the transportation sector, we often identify a need and similarly default to a solution, that is to build more lanes or construct a new roadway. A more data-driven approach would look like this. The check engine light comes on, and you diagnose the issues to determine what is causing the problem. You may develop and test a range of solutions in order to identify the most cost-effective way to solve the problems and their causes. The idea is to solve more problems with the limited funding available. Since the Project Pipeline program began, we have been working to improve the tools that will allow us to more quickly diagnose and understand what is causing the issues. As part of Project Pipeline, we have centralized the collection of many data sources into a series of dashboards that will allow us to have a more standardized approach to how we analyze and present data. This will reduce the time and effort required at the beginning of a study to collect data and decide on analytical methods. The dashboard approach has allowed us to centralize and streamline data compilation and analysis to more quickly turn data into information that can be used to make decisions. Let's walk through a few samples. A crash data dashboard shown on the left allows us to understand what types of crashes are contributing to property damage, injuries, or fatalities. We can use the dashboard to limit or expand the analysis area or filter the types of crashes to more easily identify patterns and trends. For example, we might look at an area within 2 miles of a study corridor. We can also pull the number and types of crashes at specific intersections. Further on the screen, the travel time index dashboard allows analysts, like transportation planners and traffic engineers, to look at traffic volumes and congestion levels in varying ways. This includes at the level of hour by hour, which can compare rush hour versus off-peak times, as well as by day of the week to understand variations in travel patterns, and also across multiple years to understand how trends have changed over time. These dashboards are meant to provide a consistent way for us to improve our access to and evaluation of data over time to more quickly diagnose problems, so we can recommend improvements that will result in better performance. Additional data, such as that from local or regional sources, can be integrated into the process and program as it is available. The reports and deliverables prepared for the project pipeline program are designed to be concise and easy to understand. Summary sheets, like the one shown in this slide, are used to visualize and frame the critical safety, operations, and multimodal transportation needs along each study corridor to develop solutions that improve performance. You can find a summary on each study page. The project pipeline program consists of 3 phases. Phase 1 involves diagnosing and understanding problems and brainstorming a range of potential alternatives. This phase includes coordination with local jurisdictions and regional organizations to ensure that we have local support and participation in the study process. Phase 2 involves public engagement to assist with confirming our understanding of the problems and causes, obtaining input on and narrowing down the range of potential alternatives, and identifying the most cost-effective solutions. During Phase 3, the objective is to have a comprehensive investment strategy that can be used to pursue funding opportunities at the local, regional, state, and federal levels. Phase 3 also focuses on understanding potential risks involved with a particular project, so a detailed scope and reasonable cost estimate can be finalized. Public involvement is a critical element in the development and delivery of transportation projects. The people that live along or use the corridor on a daily basis can provide key insights into the issues and challenges that exist but might not show up in data. This leads to better and more complete solutions. Help us improve travel in your community by providing your feedback on surveys for studies in your area. Links to each survey will be posted on the study web pages and available through social media such as Facebook and Instagram. In closing, for more information regarding Project Pipeline, including the studies that are currently being evaluated, please visit vaprojectpipeline.org. If you have any questions, please submit them through the contact form on the website. Thank you again for your interest.